All right, everybody, we want to talk next about how we can help older adults be healthy. There is a nationwide initiative. It's called Healthy People 2020. Actually, it was started several years ago, and each time they do an update, they change the year. They do it about every 5 years and look at where the overall health of the community is at today, and then try to write some goals and objectives to help improve the health of our population and community populations. So for Healthy People 2020, the goal is overall to improve the health, function, and quality of life of older adults when we're dealing with older adults and just looking at that part of Healthy People 2020. And a couple of the objectives that pertain specifically to older adults: increase the proportion of the healthcare workforce with geriatric certification. That would be nurses, physicians, and others who specialize in geriatric medicine, geriatric nursing, anything that we can obtain a certification in. Also, they'd like to increase the proportion of older adults who are up to date on a core set of key clinical preventative services. That will include vaccinations and other preventative services to help keep them engaged in their community and active. And then the third one I pulled out is to reduce the proportion of older adults who have moderate to severe functional limitations. And that is really related to the previous objective because if we can limit the functional limitations, they can engage in more independent living and are typically considered to be healthier. Those with moderate to severe functional limitations require more assistance with their care from medical professionals or family care providers, and that costs more, both from a family perspective, unpaid caregivers and paid caregivers across the nation. So, but what is health? What in the heck does that mean? You really need to ask each of your residents and patients what health means to them, because it might mean something different depending on what their current chronic illnesses are. But if we look at health, just health in general, we're going to look at that holistic picture of our individuals. We're going to look at food, exercise, spirituality, relationships, stress, all of the things that are listed on this word cloud. And using all of these holistic components, we can build a pretty good idea of what it might look like to be healthy for a particular individual. Then next you might think to ask, well, can someone consider themselves healthy if they have one or more chronic conditions? And I think it really depends on how well they self-manage those. They might consider themselves healthy. Their healthcare providers may not. So we need to find a way to match our goals and objectives from the healthcare perspective to the patients and keep those realistic for both parties. So it's always interesting to ask your patients or residents what it means to them to be healthy, what a good blood sugar level is for them if they're diabetic. What is it about their life that changes when they're not feeling well? And how can we help promote good self-care management and activities to promote the best state of health possible for that person? So promoting health and wellness in older adults, we want to think about that. Of course, in medicine, it means we don't have any disease at all. However, for older adults, since so many of them have one or more chronic conditions, we usually are going to look at body, mind, spirit, and achieving the best quality of life possible. So our focus for older adults is going to be on that quality of life And we want to make sure we consider physical, mental, social, and spiritual well-being. We have a lot of different nursing theories. They don't necessarily attempt to answer why and how people age, but rather to guide essential care to promote the wellness of older adults. And we're going to talk about other theories that deal with older adults and promoting health and wellness as we move throughout the semester. We'll talk some more during this lecture about functional consequences theory, which is a framework to promote wellness, function, and quality of life for older adults. So to apply wellness to our residents and patients, we want to think about first what it means to them to be well, and then encourage persons to maintain control and independence of their health. If you asked just about anybody, what would be the ideal location for you to die in, they're probably going to say their home. In order to stay at home, they need to maintain that control and independence of their health. To apply wellness techniques means to change healthcare behavior, and we can really do that at any time and at any age. Sometimes people think that they can't do it because they're older, but we really can. So really encourage your patients and residents to make one small step at a time in order to improve their wellness, their control, and their independence over their health. So when we think about why wellness is important, we want to think about that quality of life. We want to think about healthier physical and mental health, active social interaction, financial independence, and being an active part of the workforce, volunteer community, whatever it is that gives an individual meaning in their lives. We can improve wellness participation by considering some community support. So think about what's present within walking distance for an older adult. Consider all of the different categories that we've mentioned so far: physical, social, spiritual, intellectual, occupational, and emotional. The more we can keep people socially engaged actually does two things. Being socially engaged means I am getting to the location where people are being social. That means I must move my body to get there. And the more I move my body, the easier it is to move my body. But because I'm engaging in social interaction, I'm also stimulating my brain and my cognitive reserves, and so I can keep that brain healthier for a longer period of time too. And since dementia and cognitive decline is one of the huge reasons why people are admitted to long-term care facilities, it is essential that we keep that brain moving as well. Also take a look at what's the needs are in a particular area. Public health nurses and senior centers regularly assess the needs of a community. You could ask them for the last survey that they did about needs in the community. If you did that, I'd start with the public health nurses first, and then attending education sessions to help support wellness needs, attending physical fitness sessions at the level that they can perform, and just engaging in a variety of community support and resources.